Again, today is June 4th of 2022. I'll post this on my website, healthythinking.substack.com, and you can take a look at it yourself. I mean, it's just totally stupid. So let's look at some other articles to further establish the stupidity of this one. So here, what they're trying to say is that melatonin is poisoning kids, and ultimately, what they're trying to push for is to get it pulled off the market. Same thing here. Using melatonin for sleep is on the rise, despite potential harms, and they show zero harms whatsoever. Let's look at some legitimate research. So again, this is a legitimate article published in a legitimate journal, Journal of Pineal Research, 2005. I think this is a society journal. I'm not exactly sure. Let's see if I can find that. Just for, not that it matters too much, but I have interest to see if I can find it here. So I can't. So anyway, melatonin reduced the risk of death at 1 year. Relative risk was 0.66. So that would mean a reduction in the risk of death by 34%. That's pretty damn good. That's better than most chemotherapy. And this is a nutritional supplement that you can buy over the counter. Effects were consistent across melatonin dose and types of cancer. No severe adverse effects were reported. Substantial reduction in the risk of death. Low adverse events and low cost related to this intervention suggest great potential for melatonin in treating cancer. Let's go down and take a look at some of the doses that they used here. I'll try to make that a little bigger. Let's do that, see if that works. Yeah. So again, this was published in 2005, and you can see that the doses that they used were consistent with what we've used in clinical practice since that time. 10 milligrams a night. I personally take 20 milligrams per night, every night, virtually. Sometimes 40 milligrams, fine. 20 milligrams, 20 milligrams. Here they took 20 milligrams in the middle of the day and 20 milligrams at night. That's fine. 20 milligrams, 20 milligrams, 20 milligrams, 20 milligrams. So fine. That's what they did. And remember, these are already sick patients. Excuse me. These are already patients who have cancer. So they would be more fragile and more likely to have adverse effects, more so than the general population. So if these sick, terminally ill patients can take 10, 20, 40 milligrams and not have any problems and then have significant benefits, then obviously, the risk of this treatment is we would expect it to be quite low for the general population. So we've looked at that. Here's a relatively new article. This was just published in 2022 by Russell Reiter and colleagues. Russell Reiter